Peter Mayfield is here from Gateway Mountain Center. He is a longstanding advocate for a close connection to nature as a key to health, and he's committed to changing the system of mental health care, especially for youth suffering from serious emotional disturbance and complex trauma. He's currently the executive director and founder of the Gateway Mountain Center, a nonprofit organization in Truckee, California, which is at the forefront of delivering innovative nature-based methods to support young people in their capacity to learn, heal, and thrive. Over the course of his 40-year career as a leading entrepreneur in the field of embodied peak experience and a world-class climber, Peter has guided thousands of people through transformative adventures in nature and mountain environments. He previously served as the chief guide of the Yosemite Mountaineering School and is the founder of City Rock, one of the world's first full-service climbing gyms. And he's also just an amazing leader in this field that has done much of the foundational work that we all base what we do on. Thank you, Peter.
Thank you so much, Dr. Razani. I met Nusheen at a conference, and she was speaking on a panel, and she said, someday there will be you might be able to get a copay for hiking boots. And someday there will be a Medi-Cal code for this. And I was kind of jumping up and down in my seat because we were about a month away from getting certified as a Medi-Cal provider. Over the last 10 years, we have built a system and a program that we think could be a really useful model or example of a way to bring treatment out of the clinics and right to where the kids are. And when we think about this, if ACEs Aware is successful and most pediatricians start screening, we could end up identifying like 1.6 million youth who have a score of 4 or more, which would be mandatory referral to services. And there will never be enough licensed clinicians to meet that need. So 11 years ago, we were operating wellness and adventure programming in our alternative education system. So the continuation high school and the community schools, which is a new name for what they used to call court schools. And the Mental Health Service Act in California had a big emphasis on innovations. So we proposed and applied for innovation funding to start our program, which we call Whole Hearts, Minds, and Bodies, Nature-Based Therapeutic Mentoring. We did this because we were observing directly how difficult it was for these high-need youth to access behavioral health care. In many rural counties, as in ours, behavioral health is co-located with law enforcement. So for a high-need youth on Medi-Cal to go see a therapist, they go to the same building as the court, child protective services, probation. They have to wander through those floors to a wonderful therapist on the 3rd floor in a windowless room. We set up a program where licensed clinicians could supervise well-trained, well-paid paraprofessionals who could spend 2 or 3 hours one-on-one with these youth, mostly outdoors, pick them up from school, drive out. Sometimes we kayak, sometimes we walk. If it's pouring rain, we sit in a cafe and do artwork and journaling. We spend this time, we feed them, and we bring them home, and we connect with their families. We're like in the living room, sharing the stories of how well the youth did that day. So our delivery system today, we have 7 licensed therapists who clinically supervise 24 well-trained therapeutic mentors. And our caseload today is 55 youth who get seen one-on-one each week. We went in 18 months from a funded innovative experiment to a full service contract with our county. And then 2 years later, we were certified as a Medi-Cal provider, which was not easy. Because of this approach, taking youth out of the clinics and into the woods, we're showing some really interesting results. Over half of our caseload are youth from Latinx families. 91% of these kids are still doing weekly sessions after 6 months, which is our retention rate. 69% after a year. This is these are really impressive results. Our treatment method we call 4 roots for growing a human. Root number 1 is authentic relationship. Number 2, connecting to nature. Number 3, embodied peak experience. And number 4, helping others, connecting to community through service. We feel that the 2 to 3 hour sessions that we get to have with these youth, and we say that our treatment is shoulder to shoulder, sharing experience, as opposed to like on the couch, eye to eye. And for a lot of these adolescents, this is really effective. I want to emphasize that our service is reserved for youth who are classified in the Medi-Cal system as severe or moderate severe. So the level of like wraparound, and we are partners in wraparound in our 2 counties. This consistent caring relationship with a non-parental adult is the most important thing. And so for us, nature is the context for that therapeutic bond to grow. We are connecting our work deeply to the Child Trauma Academy in Houston, run by Dr. Bruce Perry, and the Trauma Research Foundation in Boston, run by Dr. Bessel van der Kolk. Nature, the topic of this whole webinar, of course, has huge health benefits. For us, it's the present moment experience of the sensorial impact, like the patterns, the sights, the smells, the movement of leaves. And so for us, engaging in nature is a mindfulness activity. And we know that that's really powerful. And we connect to the like attention restoration theory and some of these other things. It's also a connection to the life force. We're always looking for those moments of awe, finding the toad eggs in the edge of the pond, or the insects, or the budding flowers. Embodied peak experience is a more immersive and physical engagement. So a lot of the youth we work with are not athletic at all. It's rare that they would do this rappel. A lot of them have been on antipsychotic medications for years. There's a lot of obesity in our caseload. But we say we look for the climbing on flat ground. We're finding that log across the creek, the rock pile, kayaking on a windy day on the lake, snowshoeing, anything that's kind of rough ground that activates the vestibular, the proprioceptive, the sensory motor, basically, the cerebellum and the brainstem. There is some really interesting neuroscience that supports the efficacy of this. We connect to the work of Dr. Ruth Lanius up in Western Ontario University and her team. They have done hundreds of brain scans on adults who had early childhood trauma, and they see signature weak connectivity in parts of the default mode network. And there's a growing hypothesis that repeated, well-supported activation of those neural pathways can strengthen these weak connections. And indeed, we see that. Kids we start with might have this like slumped kind of beat down posture. They're not connected to their bodies. After these weekly sessions, literally they go from slump to looking up and out and engaging the world. And that correlates with a lot of behavioral change. Helping youth find meaning and connecting to community through service. Sometimes it's at restoration projects in nature. Sometimes it's just volunteering at the food bank. This is also a key pathway in our method. We do the YOQSR assessment. The county does the CAN survey as well, but for us, the YOQSR is accessible, and we're showing significant reductions of symptomatic distress, 45% intrapersonal or emotional distress, 45% reduction in interpersonal relational distress, improvements in reduction in somatic distress, and critical incidents. So many of the youth we work with have had expulsion from school, psychiatric, 5150, psychiatric crises in a hospital, incarceration. And so we see this go down. This has big implications on our system of care. In terms of county behavioral health contracts and Medi-Cal, and the whole everything, case management, clinical supervision, we spend about $10,000 a year to treat a youth effectively in weekly sessions. But compare this to 300,000, over 300 for incarceration, or the national average of a visit to a hospital for a psychiatric crisis, which I'm sure in California is higher than 15,000. This is money well spent. Our community really is supporting us because they notice the impacts that ripple throughout. So our hospital district contracts us because they see that if they refer a youth after a 5150, a psychiatric crisis, they're much less likely to have a repeat event. The probation department refers kids because kids in our program are successful in probation. And this has many ripple effects. We think this is an example worth spreading, and we are working hard to bring this program from the eastern part of California to the Bay Area. We're currently working with UCSF in the hopes of doing some research projects. We think this would work wonderful in Bakersfield as well. And thank you very much for your time and attention.
Thank you so much, Peter. That was super inspirational, really.